Greetings, my name is Harriet Kebirungi. I'm a palliative care nurse and I work with Rays of Hope Hospice Jinja, and I work in the cervical cancer screening department. My topic is about increasing access to cervical cancer screening services in the community of Namayingo district. Namayingo district is found in the far east of Busoga, and we are bordering Busia district. Cervical cancer is the third most common cancer among women worldwide, according to WHO. The majority of the cancer cases occur in low, middle income countries within the sub-Saharan Africa, carrying the highest burden globally. Uganda has one of the highest cervical cancer incidence rates in the world, accounting to 45.8 per 1,000 cases. This is as a result of limited screening access and infrastructure. At Rays of Hope Hospice Jinja, cervical cancer is the most common cause of cancer death, accounting to 40% of all women with cancer enrolled. The diagram I'm showing shows the global picture of the cervical cancer in the world. And it is showing that cancer is almost eradicated in the income countries, and the burden is in the sub-Saharan Africa. And this is as a result of limited access to screening services, which hinders the progress towards alleviating this cancer in Africa. So we see that cancer can be prevented if we have screening programs in place, vaccinations of the young girls between the ages of 9 and 12 years, and also awareness campaigns. This can help to create awareness in the community. Cervical cancer in Uganda is, new cancers in Uganda account for 19.7%, of which 35% are new cases in women. And the most burden is on the 22% of all cancer deaths, which are occurring as a result of cervical cancer. The aim of this program was to provide access to early diagnosis and treatment for cervical cancer for mothers living in the Namayingo community. To also develop a model accessible for cancer screening services in the rural health centers. When we reached on the methodology, we started off with meetings, bringing together different stakeholders, among which we had the DHOs, the health center in charges, and the health workers who needed this training. A 5-day training was conducted for the health workers that were identified by the in charges from the 2 health centers, that is Buyinja Health Center 4 and Banda Health Center 3. They were taken through a 5 days training, 2 days of theory and a practical training. A camp which was organized mobilized mothers who came to be screened, and the trainees were able to have hands-on training during this process. Mothers were screened, and the equipment used was enabling the trainees to be able to treat the precancerous lesions. And with the guidance of the screeners, the trainers, these trainees were able to gain practical skills. Close continuation is ongoing for these health workers to help them in strengthening their skills. Some of the activities that were done was to empower the community through education processes. In July 2021, a launch was done whereby the 2 health centers were given equipment to be able to continue the screening process. And this was successfully established in the 2 health centers in the district. That is Buyinja Health Center 4 and Banda Health Center 3. Screenings are now regular for women, and those who are found to be VIA positive, they are treated on site using the thermal coagulation machine. And with the DHO's involvement, these trainees are given time to be able to integrate the service into their existing programs. On ongoing activities, there is integration of cervical cancer screening and treatment of the precancerous lesions in the 2 health centers. And this integration was possible because of the routine services that are being offered at the health centers. When mothers bring their children for immunization, they are sensitized while they are waiting, and in the process they are encouraged to go for the screening. Likewise, even in the art clinic, the mothers there who come for art treatment, they are also sensitized, and then they are able to come and they are screened. Cases that need further care are referred to the Rays of Hope Hospice Jinja team, and we carry out home visits as a continuity of care for the mothers who have suspicious lesions or who have cancer. They are visited at home and further care is given to them. We also continue community education as a result, and this is a benefit for the mothers who need the palliative care. Some of the observations made was there was a high turn-up of mothers who came for screening during the camps, and this was attributed to the extensive mobilization that was done. In the subsequent clinics, the turn-up is low because the mothers who come for these services of child clinics and art, the numbers are relatively low. There is also poor mobilization. Then another big issue is the issue related to constant lockdowns, which hinders these mothers from moving to the health centers to be able to access this service. Close supervision is done to ensure the routine services continue at the health centers. In conclusion, collaboration with the DHO, the health center units, the other partners have facilitated the integration of screening services in the existing district program. Advocacy programs are underway, and we hope to duplicate this service to other districts in the Busoga region. Thank you so much.